Hi guys, good afternoon and welcome. Thank you for coming along to hear our presentation today. I'm Sarah Reid, this is Sam Stone. We're part of the workforce team at SCW, so we work on a range of workforce related projects and programmes across the system. So if you were here for the previous presentation, you'll have heard Jeff and Richard talk about the plan for their ICS space and the questions that were asked around, well, how is this delivered? You know, where does the workforce come from? What we wanted to talk to you a little bit about today is some of the work we've done in several different spaces, from primary care to mental health and in diagnostic and radiology and pathology networks, to have a little look around how we can work and do things differently and more creatively to free up workforce to work in a different way. So we've got a few case studies to talk you through, and Sam will talk you through some of the theory of how we work. But in effect, what we're doing is we're taking data, quite a large amount of data, working with a lot of our analytical colleagues in SCW, from patient and sort of health inequalities, from data quality indicators, as well as the workforce data. And we're putting those together to really kind of clearly define what the local population needs are for patients and communities and populations. What we then do is we take a kind of a mirroring lens and we look at our workforce, but taking it from a different angle. So I think when you get to sort of high-level workforce planning, you can end up going quite high up in your viewpoint, and you can kind of lose some of the individuality that people can bring. And so what we've tried to do in our approaches, which we'll talk you through, is to kind of look at, rather than roles and number of roles, we've tried to look at skills and competencies on top of licensed working to try to understand how we can map what the patient needs are locally to what can be delivered in different ways within your workforce. And this has meant that we've been able to create more creative solutions and opportunities for us to meet the patient needs locally and move beyond traditional role-based workforce planning to a very skill and competency and patient-focused workforce planning. So we'll talk through some of the theory and some of the examples that we've got within those spaces. So I'll hand over to Sam.
Good afternoon, everybody. Can I just get a show of hands who is part of their role is around kind of workforce planning, strategy and implementation, just to get a view, or people that are interested in terms of knowing a bit more. So there's quite a few of you there, so that's really good. And what we really want to kind of address today is some of the misconceptions of workforce planning. So some of the key things that we hear time and time again in terms of people's approach to workforce planning. And what we really want to do today is to kind of take you through the art of the possible. What could be different about your workforce planning that considers people and put people at the centre of what you're doing. So you may be looking at some of these speech bubbles here and thinking, oh yeah, that's me. And before I moved into workforce, I was in service development and evaluation, and quite often some of these things I was very guilty of, and actually being able to come and really get into what would work better. How can we really encourage a thinking of people? Because without people, there is no organisation. So we really need to think about who they are, what they do, and the contribution they bring. And 70%, there's a good quote, 70% of organisational change fails. And quite often that's because we don't think about people. We think about it as an objective process. And it's the same for workforce planning. So just taking 20 minutes to do your workforce plans isn't really considering who you've got, what they're doing, but also the future of it. So I'm not shaming anybody, but do people recognise some of these things themselves? I can see some nods. So what we're aiming to do is to get you to start thinking a little bit more broader and thinking about what's available to you in order to do your workforce planning, strategy and delivery more effectively. So at SCW, we've been working on our workforce optimisation approach, and we've been working on this alongside lots of our teams. So working, and you'll hear some of the examples, we'll be telling you about some great interventions with our primary care team, with our mental health team, and then some bits that we've been developing in our team. And it is a very early start of our journey, but we wanted to share this today to give you an overview of it. So the real important part is using data, insights and expertise to think about actually what is the problem here? What is it that we're trying to solve? And quite often people go straight to the solution without thinking about, am I making an evidence-based approach? And when people think of evidence, they think about data and it just being about qualitative data. But what we are trying to say and think about is how we can broadly bring in more qualitative data. What are the opinions, experiences and feelings of the workforce? How can that shape our approach? Because one size doesn't fit all. And actually, as we've said, change fails where you don't engage people. And we want to take it a little bit differently as well. So quite often when I'm working with people around their workforce plans, they say, I want one of them, one of them, one of them. And I sometimes say, well, why do you want one of them? Well, that's the way we've always done it. These are the roles that have always delivered healthcare. And you'll find from listening to lots of the presentations today and tomorrow that actually we don't have the workforce. There are high demand, low supply roles. So we need to think a little bit differently about how we do things. So what we've been doing in our approach is taking a skills-based approach. We're thinking about the content. It's the what and the who. And we start with the priorities. What are the priorities that you're trying to address? What skills will people need? And then what roles might be able to deliver that? And are you thinking that there might be some alternative solutions to that rather than the traditional approaches? And this is very theoretical at the moment, so there will be some examples. So hopefully it will bring it to life. But I wanted to kind of start there. But actually, you need to think about processes, because quite often people expect workforce to start and just plug and play. Oh, they're skilled. They've got that job title. They'll just be able to do the job. And actually, you need to be thinking about how do they actually embed into the organisation? How does it integrate with what other people might be doing? Because that's when you can sometimes get problems where people are doing part of a job and you bring someone else in and they're like, well, what's my job now? And so you need to be really careful about dynamics and think about it as a collaborative approach. What is the engagement? What is the motivation? And what is the values of the workforce? And then what often people forget is the context. So when you're planning your workforce, you might just be thinking about, okay, looking down at my organisation, what do I need? Without necessarily looking at kind of what's going on around you. What are the supply and demand trends? What are the opportunities that might be presenting themselves? What's happening in policy? So quite often people forget about kind of the environment when they're planning. And what we're trying to do for our approach is let's have a look at kind of what's happening in your local environment, your regional environment, your national environment. But also mindset is a really important part of it. And actually the mindset that your leaders have can influence how successful your workforce planning is. So this is just an overview of some of the elements of the workforce optimisation approach. So depending on which part of the health or social care sector we're looking at, the data and insights might be slightly different, but it's very much around thinking about what can tell me about the content, so with the skills, what can tell me about the dynamics and the collaboration, so thinking about actually speaking to people about their capacity, their capability and their confidence in actually what they're delivering, and also the system, the wider system. So what are some of the national, regional and local population health needs and what does that mean for my organisation? So we've also been looking at kind of how can we support people that are at different stages of their journey. So what we've developed here with colleagues is a maturity and readiness for change diagram. And so we've got maturity, so that's more about your objective performance. So how well are you performing with your workforce planning, your delivery and your strategy? Do you actually have a strategy? Do you have a plan? You know, sometimes we work with organisations that haven't started. Is it based on data and insights? Do you have governance and accountability? So we talked about that, we only need to do it once. Actually, are you going back and having another look at that? And collaboration and teamwork. We find that someone will say, oh, that's the responsibility of that person. But actually, it's everyone's responsibility. If you need people in your team, you need to be thinking about this. But that's only one side of the story. And the other side is around readiness for change. So actually, one size won't fit all, depending on some of those things that we've discussed already are around kind of mindset and finance. We all need to consider finance. So how ready are you, and how ready is the organisation as a whole for changing kind of your workforce and for preparing for the future? So we also, when we're working with our clients, we look at kind of what's their ability with workforce planning and their optimisation. How confident are they in their skills and their capabilities to deliver it? And also, is there organisational buy-in? So you need all of those things. And what we've identified is there's kind of different levels of support, which we'll talk you through with examples, based on people's maturity and readiness for change. So we've got an intensive option, moderate option, and a trailblazer. So we'll start with the most comprehensive one. This is if you need intensive support. And so we've done a piece of work in primary care. We were commissioned by an ICS to support their PCNs with workforce planning. So the workforce team collaborated with our primary care team to think about, okay, how can we do this differently? So as we said, we got some data and insights here. So the more objective stuff, we looked at kind of population health data. We looked at national performance indicators. So for primary care, which is the example we're looking at here, we looked at the QOF, the DES, the IIF, and we looked at, okay, so what are their needs based on that? What are the priorities? We looked at their performance data, and we also looked at their workforce data. So things like retirement risk. What will they need to plan for in advance? Then we looked at some of the qualitative insights and feelings, because that really helped us to understand and give some colour to this. So I like to use an analogy. The objective data is your dots. The qualitative discussions that we have with our clients is the colour, and together you get the big picture. So you need both. You need to be able to understand their context, because it is very complex. The world of primary care, in this example, is changing massively, and we need to be able to deal with the complexity. And so the output of this was that we delivered for them an individualised report that gave them recommendations of how they could do things differently. So I can share some of the recommendations here. And you can see that there's only one that actually says workforce planning. The rest were around kind of elements that they needed to consider. But what was most key was thinking about where they were in their PCN development and leadership journey, because that would influence how effective and how successful their approach to workforce planning and strategy was. And it was also looking at that shared accountability, the complex picture that PCNs have at the moment, each at a different level of their journey. Actually, that's where you need to start, and you can't forget that element. Ooh. Sorry, I've skipped a few. So our moderate support is, so this is in the children and young people's mental health space. So we've been looking at how can we help people, rather than doing it for them, how can we help them to build a toolkit that they can use and go away and have some of these conversations themselves? What are the sorts of things that we would be doing with them to help them to take this forward? So the next kind of moderate level of support was we would do a piece with them around workforce mapping. So we would do a deep dive of some of their roles. So this would be high demand, low supply roles or future critical roles that they'd identified. And we would do a profiling exercise to look at exactly what it is that those roles did, just so we can get an understanding, because people talk about top of license, but unless you actually really get into the nitty gritty of what roles do, you can't understand what is top of license and what might be something another role could do, and where you could be able to kind of differentiate and have different solutions. We also looked at their priority outcomes. So in that sense, we looked at kind of what was it they wanted us to look at specifically. So that might be health inequalities, it might be about restructuring their service, and we would look at, so how do these roles contribute to that? And then the third part is to develop a toolkit so they're able to do it for themselves. So this is just a little overview of what we include in the role profiling. So you can see it's quite broad, We think about not just what core skills they've got on the training qualification requirements, but also what the additional skills will be with training, because actually people think they need to get a new role in, but they might not. They might just need to upskill. And we also think about the development potential, because actually when you're bringing somebody into an organisation, you don't want to just think, okay, they're here to do this role. That's very short-sighted. You need to be thinking about career pathways, and you'll hear that a lot over the next couple of days. And what we wanted to do by doing this for some of those traditional roles that people kind of focus on is to start thinking about what some of the alternatives might be. So what are some of those skills that someone else could do? So these are examples of some of the priority outcomes and the levels. So you can see it could be anything, but it would be bespoke to that organisation. So just go through those. So population health, service delivery, organisational, and workforce outcomes. So we can do things bespoke that help people to think, what's the solution? So this is an example of a piece of work that I did with the mental health team. Hi, guys. So one of the key things is looking at where do you have similar roles, and actually you've got two different education and career pathways. So for instance, we've got children's wellbeing practitioners that are working in NHS CAMHS providers, and we've also got education mental health practitioners that are working kind of in education settings and schools. But they've got the same skill set. So could we be thinking about how can we be building a pipeline for both, and then thinking about actually, is there an opportunity for rotational roles? But mapping it out, you can see actually everybody's going to be wanting the same roles. So actually you need to be thinking about how can we build more, but in a safe way. So another example here is where we were looking at redesigning a service, and these were the roles that people wanted, so nurses, psychologists, occupational therapists and administrators. High demand, low supply. How can we support, through workforce optimisation, the idea of helping some of these roles that we can't get and we can't recruit to work at top of licence and have different alternative solutions that can support delivery? So in this context, we looked at skills in terms of 4 kind of categories. We looked at clinical leadership and service development. It's a very kind of finite bit, so actually, you know, that might stay with some of these traditional roles. And then we looked at kind of clinical, and then we looked at kind of clinical support, and then we looked at non-clinical admin role. And actually we could see that there were opportunities to blend in different roles that could meet some of those skills that these traditional roles were responsible for, but they didn't need to be clinical to do it. So you can see here there's bringing in new roles such as physician associates and nursing associates, but also designing new roles, so having care navigators and coordinators. So in the previous, if you were here for the previous talk, you would have heard about the importance of care coordination. So these are individuals that are not clinical, but they can offer that support to families and to parents. It's getting a bit happy, my old clicker here. So the third trailblazer. So if you're doing really well and you've got kind of your workforce plans and your strategy sorted, but actually you want to build the capability across your organisation and to be able to do it yourself, we've got options around capability development. So what we do is we tell people how we do it. So what are the key elements of workforce optimization? What are the fundamentals you need to do? And so it's about exploring data and discovering insights and then being able to translate that into your workforce offer. So we go through an introduction to workforce planning, and that it's not just planning, that you should be thinking about it long term and it's repeated. And also thinking about actually how do you identify and analyse evidence. So people say, oh, we don't have a data analyst, we can't look at data. But actually there's lots of nationally benchmarked available data that you can have a look at. And with a few kind of sessions around data, you're well away, and you can kind of start using that to make evidence-based decisions in your workforce planning. And then we've talked through identifying and translating insights. So what are the key things that you want to take away from that? And what does that mean for your workforce and your plans? And then actually, how do you go about practically putting that into practice? So we worked with acute providers. So we worked with diagnostics and pathology to do this training. So with service leads. And it was really successful. They was like, we can see that we can do things slightly differently. And actually, we don't need to just keep doing the same thing and expecting the same results. We can think a little bit more broadly. So I'm going to hand back to Sarah, who's now going to tell you a little bit about what SCW can help with. Thanks.
Thank you, Sam. Can you just put on to the next slide? Thank you. And Sam's tried very much to present this in a way that hopefully is accessible and people can understand. But actually the level and the quality and the depth of the data that sits behind this when you see the actual projects is phenomenal. If you think about all the inequality data, the metrics, there's a lot behind a lot of this, and a lot gone into the mapping as well. So whilst it presents nicely and cleanly now, it's an intensive process. So as Sam mentioned, you can see here we're doing this in a variety of spaces, from mental health spaces through to acute and networks around diagnostics and pathology through to primary care. So we've really tried to develop a methodology and a set of solutions that we can move into different spaces, and as Sam explained, that support varying different levels of maturity depending on where organisations or systems or whatever form you're working in, where you are in your journey. So this is just a bit of a recap, really, that we've got a kind of foundations piece for those people who are further along in their journey and who just want to understand how they can undertake some of this more advanced diagnostics themselves, where we do things like world cafes and online learning and a whole range of different optimisation around capability to help people just take their maturity around their workforce management just that step further along. We've got other pieces then, as we say, moving into slightly more mapping and skills based, and that can be done at a small scale or slightly larger, right the way through to a very intensive global support, which looks at a massive amount of your data and really drills down. So I think the ICS that we work with, it was how many PCNs did we do for the ICS piece? 7 PCNs, and they talk about as the early adopter, potentially going out to 2630. So, really, really local, but can go up to system level as well. So yeah, that's a little bit about what we do and how we do it, and the journey that we've been on probably over the last year to help people understand their workforce and their workforce future needs a little bit better. So thank you very much for your time. If you've got any questions, please do let us know.
Thank you. So if you do nothing else, we almost forgot this slide. If you do nothing else from this presentation, think big picture. What are the factors that are going to influence your workforce moving forward, those environmental factors? Find the best available evidence and data for making workforce decisions, and do take a skills-based approach to meeting population health needs. Now you can ask questions or leave. Thank you, everyone.
Thank you.